So Kylie, if you want to go ahead and get started.
Hi, everyone. My name is Kylie Hump, and I'm the Chronic Disease Director here within the South Dakota Department of Health, and I oversee our chronic disease prevention and health promotion programs, which includes, we've been overseeing our opioid misuse and abuse work as well over the past 3 years. And so today I'm going to be talking to you about our South Dakota opioid resources that we have available. I also mentioned here the South Dakota Department of Social Services and their Division of Behavioral Health because they are a key partner in this work, and specifically these opioid resources that I will talk through today. Next slide. So here is some resources that I will briefly touch on here today that are all located on our avoidopioidsc.com website. And so resources actually were a huge priority within our South Dakota opioid roadmap, also known as our statewide strategic plan. And that was developed with a statewide advisory committee with various partners from across the state that do work around opioid misuse and abuse in South Dakota. And so resources, to raise that public awareness, to also enhance awareness of treatment options as well. And so that's what we're hoping with these variety of resources that have been developed. We've established a resource hotline. We've created an online searchable resource database. We provide 1- and 2-way texting services for individuals. And we've also established an opioid care coordination program, which helps individuals through dealing with any opioid-related issue that they're having. And really a key partner in a lot of this has been the Helpline Center. They have been a key resource in managing these different types of resources, providing the staff available to respond to the text message, to the calls to the hotline, developing that searchable resource database, and also facilitating that opioid care coordination program. Next slide. So here just lays out specifics to some of those resources I mentioned. So the South Dakota Opioid Resource Hotline, there's a specific 1-800 number there. There's someone available 24/7 every day of the year. So a great resource for anybody that is for the whole spectrum, someone that, is in crisis mode, that's really needing some help, but also someone that is looking just for some resources for a loved one, or someone that doesn't know necessarily what to do with the next steps. They don't know where a facility to maybe get an assessment done, or to just talk to somebody about things that they're dealing with. And so the Help Center, that resource hotline, is a great resource for them. That is statewide. And so anybody in any county can call that number and receive assistance in getting connected to different resources, like I mentioned. Very similar, we know not everybody wants to pick up the phone and talk to someone, so there is texting support, which again provides similar types of services. I'm just connecting you to, local resources that might be available to you. If there's a behavioral health center in your area, they'll share that information with you, things like that. And then, as I mentioned, all this information is on avoidopioidsc.com, where you can not only find information on the resource hotline, the texting support, but also that opioid care coordination program I mentioned. And so really that is a service that assists individuals with connection to that initial assessment for treatment. They provide supportive phone calls, so they'll follow back up with you on if you were able to meet your appointment and how that went, what other support do you need. They'll walk through and say, is there any barriers, things that you're dealing with that prevent you from getting help? Is it housing? Is it transportation? Or assessing individuals for other risk factors like suicide or other mental health issues that they're dealing with, and helping them figure out navigating that environment. And so that's a great program that really provides that individualized service for folks that are dealing with opioid misuse or abuse. And then I mentioned the searchable database for resources. So this is where we've created one-pagers for almost every city within our state. So you could go on there and look up Aberdeen, and it comes up with a one-pager that you could post in your office. You can post in a local organization, bank, you name it. It's a great resource that says, you know, where there's a drop-off site near to you, where you had unused medications that you could drop off there safely, where your closest emergency room would be, where you can get that initial assessment and treatment within your community, and really, again, provides that text number and that resource hotline number as well. So a great kind of one-page resource that you can have up, you know, that's specific to your individual city, community that you work in. And then on the website, we also have a searchable database for take-back sites. So we actually are up to 39 out of our 66 counties have a take-back receptacle located within that county, which is, we've come a long way within the last year or two, where we started with, I think, 5 or 6. And so we've really been able to expand that resource for folks that where you can dispose of those prescription medications safely. And then personal stories. This has really been something that we've been able to get a lot of traction on and a lot of feedback on, and have been really helpful for individuals to start reaching out for help. We've done South Dakota specific testimonials with 4 different individuals across our state. And those are all located on our website. And so you can go look at those 30-minute clips, 30-second clips, and hear those different stories from individuals within our state have dealt with opioid misuse and abuse within their life. And last but not least, we do have a Facebook page where we post a lot of those the personal stories, you know, reminder about take back sites, reminder about our website and the different resources available. And so I encourage you all to like that and follow us and keep up to date on all the great resources that are available.
Thanks, Kylie. Karen?
Hi, my name is Karen Cudmore. I'm the Cancer Programs Director for the Department of Health, and the next program I'll be talking about is All Women Count. All Women Count is housed here within the Department of Health, and we receive federal funding to provide breast and cervical cancer screening services for eligible women in our state. And numerous facilities across the state participate as provider sites who actually enroll and then screen the woman for breast and cervical cancer. And just for reference, I listed a couple of those, are all those clinics that are involved there at the bottom. So who is eligible? South Dakota women, they meet the age guideline of 30 to 64 and the income guidelines. We do go by the 200% federal poverty level. A woman can have insurance, but you know, the main 2 eligibility criteria are her age and then that she meets the income guidelines. Very briefly, what is covered in the All Women Count program. For a woman 30 to 64, she can have an office visit and receive a Pap test or an HPV screening test, and then for breast cancer screening, as long as she's 40 to 64, she can have, again, the office visit and the screening mammogram. If the Pap test or HPV or the mammogram is abnormal, we do cover diagnostic services. You know, we'd like to follow up on all abnormal services. So we do cover those diagnostic services, and I listed them there, some cervical biopsies, colposcopy, and you know, diagnostic mammograms and breast ultrasounds as well. So sort of what happens. So if you're working in a facility, either a clinic or hospital, it is very likely your facility is an All Women Count provider. If the woman is in need of a breast or cervical cancer screening services and she meets the age guidelines, she meets that income guidelines, we ask then that you enroll her into the All Women Count program by having her complete the purple All Women Count visit form. These forms are new, just released here in January. It's just a a one-pager. She completes the front of the form, and then the clinic completes the back of the form. All participating facilities received these forms back in December. So your facility should have these new forms. Please contact our program if you're not sure if you're using the right form. The next slide, I just list a couple of the link to our ordering materials. If you'd like to have All Women Count RAC cards or wallet cards available for your patients, those are available to order. The link is there. And then the next slide, again, is just our contact information. We have staff available, those that have worked with the program, Roberta Holfelt, Tyann Gildermaster, myself. You can call the 1-800 number and just visit with the program if you have any questions or if you're unsure on how to enroll or if you should enroll a woman. We'd be happy to visit with you.
Thanks, Karen.
Yep.
Megan.
Good afternoon, everyone. My name is Megan Jacobson, and I'm a registered dietitian with SDSU Extension. Today, I'll be speaking on behalf of Better Choices, Better Health. I'm a certified chronic disease self-management program master trainer and have worked with the program since 2014. So next slide. Better Choices, Better Health is South Dakota's statewide offering of chronic disease self-management education programs that were originally developed by Stanford University and are licensed through the Self-Management Resource Center. Better Choices, Better Health here in South Dakota is part of the network of evidence-based health programs rooted in the community. And SDSU Extension holds the license and manages the statewide hub for community and healthcare organizations and class leaders in partnership with the Department of Health and Department of Human Services. Next slide. Workshops are held for 2.5 hours once a week for 6 weeks and are offered in community settings. The program is a great complement to existing programs or treatments that patients may be currently in. And the program is really designed to enhance a patient's capacity to deal with the burdens of chronic disease. So participants select which self-management strategies they will use from a menu of options and according to their preferences. They really learn how to prioritize the conditions or issues that they're experiencing and want to address, really based on their own perceptions of what they're dealing with. So the program meets people where they are. The body of evidence related to self-management programs suggests that they improve patient-reported outcomes regardless of a patient's specific diagnosis. Next slide. And within the chronic care model, you can see highlighted with a yellow circle here on this slide that self-management support, or really how we can help patients live with their conditions, is a crucial piece needed to help improve patient outcomes, such as better health status and patient satisfaction. So the Better Choices, Better Health program fits into that model perfectly. Next slide. Better Choices, Better Health currently offers programs specific to living well, diabetes, and pain. Our current schedule of class offerings can be found on our website, located on the Good&Healthy website platform. And a participant must be 18 years or older to attend, but there are really no other eligibility requirements or specific diagnosis needed to join. A referral is not necessary, but we have found since offering this program that it really is a great motivational factor needed to encourage participants to join the program and stick with it. There are multiple options for making a referral, as you can see on this slide, including fax. We have it integrated into the EMR, currently available within Sanford and Avera facilities. The patient portal is heavily utilized by regional health to get registration and information out to their patients about program offerings. And we also have a toll-free number, which patients can self-refer or is a great resource to call for more information or to refer a patient. And with the options available, we're really able to help you implement a referral process that works best for your organization. Next slide. And this is Bridget Muntefering. She is our statewide referral coordinator who can work with organizations directly. We're currently using a management software to help us create a bidirectional feedback process that can help healthcare organizations meet those quality reporting measures for referrals. We're still in the beginning phases of this process, but we're more than happy to talk with your organization about how this process is working and talk about some opportunities to partner. Thank you.
Thanks, Megan. Rochelle?
Good afternoon, everyone. My name is Rochelle Rossman, and I am the statewide tobacco cessation coordinator out of Black Hills Special Services in Watertown. Next slide, please. And it's just important for us to always note that the term tobacco refers to our commercially produced tobacco products only and never the traditional tobacco of the Northern Plains American Indians. Next slide. Just a very brief overview of the South Dakota QuitLine. The phone number is listed there on the slide. It's 1-866-SD-QUITS, as well as you can see the website, which is www.sdquitline.com. The QuitLine, just kind of a big overview, is that they offer free cessation counseling. If a person enrolls in our free cessation counseling, they would also then be eligible to select if they would like to receive free nicotine replacement therapy, which we refer to as NRTs. So you might know those as a patch, a lozenge, or a gum. And they would also have access to receiving cessation medication, which is the prescription Zyban. People are eligible to enroll through phone, web enrollment, or fax and EHR referral. Next slide. So who can use the South Dakota QuitLine? Any South Dakota resident. They must be a tobacco user, but excitedly we added the e-cigarette users now as tobacco users under that. And anyone aged 13 years of age or older, and the person has to be ready to quit or has quit in the last 30 days. It's also important to note that people are eligible to re-enroll if the service didn't stick and the quit didn't stick the first time. We know that quitting takes multiple attempts for success, and people are eligible to re-enroll with this service. Next slide. Regardless of your specialty, you can utilize the 2 A's and 1 R method to double your patient's chances of quitting. So the first A, ask, means asking about tobacco use at every visit, and if the person is willing to quit or if they're willing to make a quit attempt in the next 30 days. The second A, advise, means that you use your knowledge and skills in a personable and non-judgmental way to advise the patient that quitting is the single best thing they can do for their health. And lastly, the 1 R means refer. So if the person is willing and ready to make a quit attempt, simply refer them to the South Dakota QuitLine. If you're unable to have this conversation with the patient, just make sure that you have materials available in a waiting room, in the patient's room. This would give the opportunity to passively address QuitLine information with the patient. Next slide. As I mentioned, we've got the option of passive referrals. So that would mean a person can call, you could call the QuitLine alongside the patient when they're in your office, or you can simply give them a QuitLine business card or brochure so they can read about it, find out more about it, and then make the call on their own. Another option is the web referral. So the patient would just go online to the website, fill out a form, and then the South Dakota QuitLine will call them back by the next day to get the enrollment process going with them. Next slide, please. The other option is a direct referral. A direct referral is the fastest and most successful way to connect your patients to the QuitLine. This can be done with a fax referral or through what we call an EHR referral or e-referral. Once the QuitLine receives the referral, they contact the patient to set things in motion and get them enrolled officially. On the right-hand side of the slide, you'll see a list of health systems that currently have e-referral capabilities. You might want to take a look and see if you are at one of these sites. Note that you guys do have the EHR e-referral capabilities. Next slide, please. I also just want to highlight the option that you all would have to utilize our PROF program, which is an online training program designed to educate and answer questions that you might have about the QuitLine. This will really just help you be more knowledgeable in helping patients on their journey to becoming tobacco-free. This training is free, and it can be done on your own time and at your own pace, which is really nice. Next slide, please. And then lastly, I just want to point out that this is our resource catalog. So if you're looking for any South Dakota QuitLine materials, just visit this website and you'll find all the resources at your fingertips. All of them are free. And next slide, please. And there's my contact information if anybody wants to reach out following this webinar with questions.
Thanks, Rochelle. Kayla, you're up next.
Hi, my name is Kayla McGee. I am the Diabetes Program Coordinator with the South Dakota Department of Health. Next slide, please. It is said that 1 in 3 Americans have prediabetes. Prediabetes is when the blood sugar levels are higher than normal, but not quite high enough to be diagnosed as type 2 diabetes. As you can see, there's these risk factors that increase the chances of prediabetes and developing type 2 diabetes. The scary thing is 9 out of 10 people don't know that they have prediabetes. So bringing these risk factors to patients' awareness and educating them on what prediabetes is and how they can make lifestyle changes is important. Also knowing where lifestyle change programs are in your area that can help these patients eat healthy, exercise, would be great to know to help them prevent the onset of type 2 diabetes. Next slide. So the National Diabetes Prevention Program is a CDC recognized program that supports a lifestyle change developed to prevent type 2 diabetes very specifically. It's just specifically for people with prediabetes. It's throughout a year-long class where a trained lifestyle coach helps participants focus on long-term changes and lasting results. The National Diabetes Prevention Program is evidence-based. It is known to work. Participants can expect to benefit by losing 5 to 7% of their body weight, which is about 10 to 14 pounds for a 200-pound individual. They also learn to incorporate 150 minutes of weekly physical activity into a busy schedule and learning how to eat healthy. The class is delivered in a classroom setting with peer support, giving participants a team of friends and neighbors to share in their struggles and their victories. The research and evidence-based program has been shown to reduce the risk of developing type 2 diabetes by 58%. Next slide. So who can participate in the National DPP? Well, to qualify and participate in the National DPP, participants must be at least 18 years old and be overweight, not pregnant, and no previous diagnosis of type 1 or type 2 diabetes. They must also have one of these qualifying indicators: a blood test showing prediabetes, that could be A1C, fasting, or 2-hour. They also could qualify by having a previous diagnosis of gestational diabetes, or the third way to qualify is to take the prediabetes risk test and receive a result of high risk for type 2 diabetes. Now, the risk tests are available on the catalog website that several other programs I've told you about, or you can also just go to the website doihaveprediabetes.org to see if they're at risk and qualify for the program. Currently, there are several programs already in the state for the National DPP. You can see if there's one in your area. Within the next year, we're going to be adding 5 more new programs. So you can see those new programs there listed. As you can see, some of them have stars beside them because they're a little more unique. They're not at a healthcare setting. Avera Corporate Health is offering to employers. Larson Manufacturing as an employer is going to be offering it to employees. And then the Medicine Shop in Rapid City, a pharmacy, is going to be offering the program as well. So programs can be offered in clinical settings as well as community settings. Next, I'm going to talk about the Diabetes Self-Management Program. These services provide information and skills for people to manage their current diabetes and related conditions. DSMES is tailored to patients' individual needs, goals, and life experiences and is guided by evidence-based standards. Patients will learn to eat healthy, be physically active, monitor blood sugar levels, take medication, problem solve, reduce other health conditions, cope with the emotional side of diabetes, and improve their health and quality of life. DSMES programs are led by diabetes educators. They are typically registered nurses, dietitians, mid-level providers, or pharmacists. It's important for patients to receive diabetes self-management services when they're first diagnosed, but there are also other times where diabetes self-management can help patients manage their diabetes. That could be like at a yearly follow-up, when health complications arise, or when changes just in their care occur. Maybe when they switch over and they're starting insulin, this would be a good time to go through diabetes self-management again. Next slide, please. So in South Dakota, this is a map showing where some of those diabetes self-management education programs are. And these are programs that are recognized by the ADA, which is the American Diabetes Association, or the AADE, which is the American Association of Diabetes Educators. And that just means that they provide standards that meet the recommendations from the CDC and have shown to be effective in helping patients manage their diabetes. If you want to know more about the diabetes locations for diabetes self-management, you can visit the Diabetes Coalition's website and explore an interactive map that lists the programs, as well as information about their services, directions to the program, and contact information on how to refer to each one of those programs, as each one of those programs are unique in their own settings. And then if you have any questions about these programs or would like information about developing new diabetes prevention or self-management programs at your facility, you can contact myself, or you can also visit the Diabetes Coalition's website, which is listed there. Thank you.
Kayla. Nikki?
Hello, everybody. I'm Nikki Prosh, Health and Physical Activity Field Specialist with SDSU Extension, and I'm going to very quickly and during these last 2 minutes talk to you about the Park Prescription Project and how it's being implemented in our state. So Park Prescription is something that is done nationally, and there's different organizations, and really it varies by state in how it's implemented. So in 2014, South Dakota piloted park prescriptions in our state, and really all the park prescription projects have similar goals relating back to increasing time spent outdoors, specifically in parks or trails, and also the goal of increasing physical activity. Next slide. So this slide here just quickly shows you some infographics that are part of the project, but really what it comes down to is it translates to all the benefits that are an individual can see from engaging in physical activity in parks and outdoors. Some of the bullets here show improvements in cognition, decreased feelings of depression and anxiety, and then improved social interactions from being outdoors. And there's also some data that shows that being active outside can actually being outside can actually increase the amount of physical activity that you engage in on a week-to-week basis. Next slide. So in South Dakota, we implement this project through collaboration between SDSU Extension, the South Dakota Game, Fish, and Parks, and South Dakota Department of Health. And overall, the project goals, as I mentioned on the first slide, really relate back to getting people in our state park system in South Dakota, getting people to be active in those state parks, and then really furthering the connection between the healthcare sector around physical activity and being that conversation starter for providers to give a resource to their patients to go be active, and then start that conversation about their current physical activity levels and do some assessment to see where they're at. Next slide. So here's a slide. I know these will be shared with you, and I don't think I'll have time to go through all of the bullets, but it basically shows how you can participate as a healthcare provider. So if in your role or individuals within your clinics or locations are in the capacity to prescribe any form of medicine, they are eligible to participate in this project and request a Park Prescription kit. In that, we send you some hard copies of the Park RX prescriptions, which are actually the actual the item that the patient will take with them to the state park to get their free entrance. So once you write them a prescription, they'll be able to go turn that into any state park, receive a free entrance into that state park for the day, and during that same day they can turn it in and get a discounted annual pass for the day to help encourage some of that lifelong, year-long physical activity engagement. And this is all on our Healthy SD website to find information to request a kit. Next slide, Brooke. This just shows a image for you of all the state parks that are available in our state. On the Game, Fish, and Parks website, they do have a park filtering tool, so you can actually look up by activity or by location or region of what the closest park is to you. And then, of course, if you want to look per activity, if you're interested or your patient's interested in engaging a certain activity, you can use that park filtering tool. So I know I'm a minute past, so last slide here. This is just my contact information. Everything in regards to the Park Prescription Project is located at healthysd.gov, or feel free to reach out to myself with any questions or comments. Thanks.
Thank you, Nikki. Thank you to all of the presenters for covering a lot of information in a short amount of time. I just wanted to quickly show where you could access additional information about these programs and order the RAC card for any healthcare professionals in your facilities. So the website is goodandhealthysd.org/healthcare, and that includes information about each of the programs mentioned. There is a picture of the RAC card on that landing page, and if you click on it, it will take you to the order form. And then you click on the chronic disease tab and you can type in the number of RAC cards that you would like to order. I'm going to relaunch the poll for those of you who joined late and perhaps didn't complete the poll. So please do so if you didn't already do that. And we do have time for a few questions. I know we're a little bit over, but we'll take a few questions if anyone has them. You will need to unmute yourself or type in the chat box. And as a reminder, the webinar is being recorded and will be available. I will send out the link to everyone who registered, and I will also send out the slide deck to everyone who registered. Again, if you have any questions, you just have to unmute yourself. Okay, it doesn't look like we have any questions. So thank you for taking time away from your jobs today to listen to the information, and we hope that you find it helpful and can utilize these programs for individuals and patients that you are working with. Have a great day, everyone.